This is one of our trauma rooms here.
Roger Baker is president of Swicord Hospital, a small facility about an hour from Washington. Like many hospital CEOs across the country, Baker says revenues are declining while operating costs are rising. He wants Washington to come up with a solution.
Well, I think that we and many others, I think, really want meaningful reform. The system is, I think, in the long run, is not sustainable.
Swicord Hospital serves the residents of Warrenton, Virginia, and surrounding Swicord County. The area has weathered the recession better than other parts of the country, but the community is feeling the pinch. Although Swicord Hospital is nonprofit, it relies on earnings over and above operating costs to maintain its facilities. It earned about 2.6% over cost last year, a figure Baker says is unsustainable.
You needed about a 5% operating margin in order to stay in business over the long haul, especially if you are in a community like this that's growing, where you had to invest in new facilities from time to time, recruit physicians to the area, hire staff.
Best of the ones so far.
Baker says the economy is part of the problem. People are putting off non-essential procedures. The number of procedures at the hospital is down 10% so far this year, but the number of uninsured patients is also rising, currently at 8% of all patients. That costs the hospital about $6 million a year.
And the way that we make up the difference for what those uninsured patients cost in terms of the cost of their care is that we have to utilize the excess of revenues over expenses, or the profits that we generate from patients who have insurance.
And that causes a chain reaction, with fees rising for insured patients and insurance companies raising premiums on those they cover. Swicord Hospital is also bracing for cuts in payments from Medicaid, a government program that funds health care for the poor. The proposed cuts could mean another 5% in revenue lost, or about $5 million a year.
We would have to curtail services somehow. We'd have to figure out a way to, is there a service that we can shut down, that we don't have to provide?
Baker says the federal government can help hospitals like Swicord by ensuring that as many people as possible are insured. That, he says, will bring down the cost of care.
Other countries are providing for similar outcomes without spending as much money. And I think that our challenge and the country's challenge is to get to a point where we can afford the healthcare system that we have in our country.
President Obama's current proposal calls for insuring 30 million more Americans at a cost of about $1 trillion over 10 years. Republicans have a plan to insure 3 million more Americans at a cost of $60 billion for the same period. Jeff Swicord, VOA News, Warrenton, Virginia.